Pittsburgh Dental Sleep Medicine's instructional video on how to perform jaw muscle exercises for use with oral appliance therapy. An oral appliance is a device that works in your mouth during sleep for the treatment of sleep apnea and chronic snoring. The appliance is custom made by our certified sleep dentist to fit over your top and bottom teeth. Oral appliances are an effective alternative to CPAP. The purpose of an oral appliance is to pull the lower jaw slightly forward, bringing the tongue along with it, which then helps open the airway. The exercises that we are about to review will help you loosen and relax the jaw muscles. It is important to always complete these exercises before inserting your oral appliance and after removing it. Doing these exercises before going to sleep will allow ease of the lower jaw to move forward into a therapeutic position. They will also aid in recapturing your bite and stretch the muscle back to its original resting position upon awakening. The first stretch we will begin with is the lateral pterygoid stretch. With the teeth slightly apart, move the lower jaw as far as possible to the left, hold for a count of 3 to 5 seconds, and then to the right, hold for 3 to 5 seconds. Complete 10 times in the morning and 10 times in the evening, as close to bedtime as possible. Our next stretch is the pterygoid release. With your mouth closed, begin by touching the tip of the tongue to the back of the 2 upper front teeth, then move the tongue tip backward from the front teeth to the hard palate and then to the soft palate, keeping it in contact with the tissue as far back onto the soft palate as possible. Then open as wide as possible, keeping the tongue tip in contact with the soft palate as far back as possible, holding for 5 seconds. Complete 10 times in the morning and 10 times in the evening, again as close to bedtime as possible. Our next stretch is our hinge axis stretch TM joints. With the teeth lightly closed, open quickly to a finger width distance between the teeth. Repeat 30 times in the morning and 30 times in the evening. The easiest way to remember this stretch is by saying mama multiple times. Our last and final stretch will be the elevator muscle stretch. Place the tip of the tongue against the back of the 2 upper front teeth at the gum line, as wide as possible while keeping the tongue tip in contact with the back of the 2 upper front teeth, and hold for 5 seconds. Relax and then repeat the stretch 10 times in the morning and 10 times in the evening, again as close to bedtime as possible.